Today I have with me a phenomenal psychologist, entrepreneur, researcher, public speaker, you name it, he does it. Dr. Michael Breus. He is known as America's Sleep Doctor. And boy, does he do his research and give a ton of tips to millions around the world. Welcome, Michael Breus.
Thank you so much for having me. I'm excited to be here. I really respect and enjoy your work.
Oh, thank you so much. That means a lot coming from you. Well, I want to talk today about grief and sleep.
Sure.
I know from my own story, after we lost our 16-year-old son, I walked around fatigued probably for at least 2 years. And that was with some very intentional exercise and food and trying to get good sleep. But I found myself really wrestling with sleep disturbance.
Yeah, and so first of all, I want to qualify that. That is 100% normal. Just to be very, very clear here, I've never seen a case where somebody has something tragic like this occur and sleep is not disrupted. I've never seen it.
I haven't either.
You know, it's just part of the process, right? And so if we know that it's part of the process, and then we can, when the situation occurs, if we can get a couple of tools out of the toolbox to help us understand what's going on, that turns out to be half the battle. The biggest thing that I hear from my patients who are dealing with grief is they feel that they cannot control their inability to sleep.
Yes,
right?
And then when that happens, you get anxious about trying to sleep.
Exactly. And so there's this really weird feedback loop that seems to occur that people get caught in. So what happens is the situation occurs, and of course people are exhausted and sleepless. Then they have to wake up dealing with whatever the plans are, funerals, processions, parties, wakes, what have you. And then when all of that starts to settle down and you've kind of gotten out of the business end of dealing with the situation, it hits you like a ton of bricks.
Yes,
right?
It does.
And that's really when I think the sleeplessness has a tendency to really come forward. And also, to be fair, there are many, many people who will talk with their doctor when the situation occurs, and the doctor will prescribe a sedative.
Mm-hmm.
That is not an uncommon scenario. Do not feel terrible about taking a sedative. Don't feel like, oh my gosh, I'm going to get hooked on sleeping pills.
Right.
You are in a unique situation.
That's
that
right.
Situation needs to be monitored by professionals, and you can also help yourself. So don't feel bad about it if your doctor says to you, hey, have you considered taking a sedative during this period of time? That's a perfectly okay thing to do. So I just want people to know and understand that sleeplessness is part of the process, and if you do require a sleep aid, there's nothing wrong with doing that. I think that's very, very important at first.
Thank you for giving that permission, because a lot of people are hard on themselves for that. And psyche is hit by a Mack truck. Right. Sometimes it takes that.
And you know what's interesting is once you do get hit by that Mack truck and you don't sleep, that level of sleep deprivation, as it elevates, it has a big effect on us, both physically, emotionally, and spiritually.
Yes.
So
it exacerbates the grief.
Exactly, especially on the emotional side. So there's a lot of data to suggest that the more sleep deprived we get, the more emotionally reactive we get.
Yes.
Also, there's data to suggest that the more sleep deprived we are, the more we see things in a negative light, as opposed to a neutral or even positive light, which can be very difficult during these types of times of super high elevated stress. And also, to be fair, when you look at stressful situations, the data is very, very clear. This is the most stressful time, period, right? It's worse than losing a job. It's worse than moving homes. It is the number one stressor. So how you react to stress historically is also going to have a play in what happens now, and that reaction can also affect your sleep. Does that make sense?
It makes total sense. And here's the double whammy with that, because when somebody is grieving, it also tends to steer towards a negative track in our thoughts in the brain, and then the negative ruminations, which then it's with sleep deprivation, it's a double whammy.
Yeah, there's no question. And again, people should just, first of all, understand this is part of the process.
Yeah.
It will not last forever. I can tell you, and I have definitely had grieving patients in my practice before, and you get through it. That doesn't mean that you get over it. It means you get through it. And I think there's a very big difference between those two words, especially when it comes to this process. Does that make sense as well?
It makes total sense. I could not agree with you more. Thank you.
Yeah. So as we look at this and these situations, there's a couple of things that people have got to do. So number one, you got to take care of yourself. One of the easiest things to miss is hydration, because you're not thinking about it, you're dealing with everything else, and your body doesn't operate well when it's dehydrated. Now, this might seem strange coming from a sleep doctor talking about this, but we know that if a well-hydrated body is a body that can sleep well. Mm-hmm. So one of the things I talk about with all of my patients during that period of time is self-care. And the biggest form of self-care to start is hydration. Our body's 90-something% water, guys. Like, we are in a dehydrated state a lot of the time. The more hydrated you are, the more likely you are to be more positive, but also to get better rest, to function better, to have your emotions be more on track. So number one step is hydration. Number two is exercise. If you can, if you're an exerciser, don't stop your routine. Continue on. If you know what reduces your stress and what helps you relax and calm down, continue. A lot of people during these times feel like, oh my gosh, I can't go to the gym because I'm supposed to be at home grieving or something along those lines. Mm-hmm. Let's be very, very clear here. Now is an important time to take care of yourself and allow the grieving process to occur. If you do things that change yourself, like changing your routine, stopping exercise, changing your sleep patterns, what ends up happening is now you got two things that you're dealing with, not just one, right? Mm-hmm. So continue on those patterns, continue to do those things that help you reduce your stress. Another big thing that I talk about with patients quite a bit during this period of time is alcohol. So there's a lot of times where people will say, I can't sleep, I'm just gonna have a drink. Or I don't want to feel this, I'm just going to have a drink, right? And I can 100% appreciate why you feel that way.
Absolutely.
Right? Like, I get it. Like, this sucks and I don't want to feel this, or I just want to go to sleep and stop thinking. I want something to help me do that. There's a bottle in there that I know will help me do that. I'm going to go grab that. While I understand it, what I would want you to understand as well from an education standpoint is there's a really big difference between going to sleep and passing out, right?
Yeah.
Okay, right? And so when we look at those ideas, right, we know that alcohol is the number one sleep aid in the world. We know that alcohol makes us feel sleepy, but at the same time, it does not allow us to get into some of those deeper stages of sleep. And when you don't get into those deeper stages of sleep, you don't get that restoration. We don't get the restoration. Why did you bother sleeping, right? So there is a combination that you need to be leery of. Also, to be fair, if you have been prescribed a sleeping pill, never, never, never include alcohol and sleeping pills in the same body. Bad idea, okay? Just bad idea. So when you look at alcohol, I'm not also saying, by the way, that you can't have a drink. But if you do, here's a gentle rule to think about. A glass of wine with dinner, let's say, or something along those lines. Remember, alcohol is a diuretic, and so you need to have one glass of alcohol, one glass of water, a glass of alcohol, a glass of water. You want to be maintaining that level of hydration that I spoke of earlier. And then also, it takes the average human body 1 hour to digest one alcoholic beverage. So if you had 2 glasses of wine at dinner and you stopped your dinner at 8 o'clock, going to bed at 10 o'clock makes a lot of sense because you've allowed your body to digest through the alcohol, you've put in hydration, now you can, hopefully get some rest. Again, we don't want people drinking right up until the point of going to sleep. That is passing out. And there's a lot of things that are going to occur. Aside from the fact that you're going to get light, crappy sleep, you're going to wake up in the middle of the night, you're going to be sweating like crazy, and you're not going to feel good the next day. Newsflash, you already don't feel good. There's really no reason to make it worse, right? And that's what tends to happen to some people. And again, I'm not saying there's anything wrong from a cultural perspective. I know different cultures celebrate death in different ways and grieve in different ways. I'm not saying anything against that. I'm just saying be smart, be careful, be mindful of your body. Because your sleep is going to be one of those things that is going to help get you through all of this. The other thing I wanted to get a brief moment to talk about, I know I'm going on and on here.
No, I appreciate it.
Is turning off your brain. So the number one complaint that I hear, regardless of the situation, is, Dr. Breus, I can't turn off my brain. So when we think about things like this, there are actually techniques that are very, very helpful for people. So number one, if you feel like you need to see a counselor, a pastor, a social worker, go see them. Do not have any hesitation. These are people who are here to help. They have dealt with these situations. They have great tools in their toolkit to be able to help you with it. So I highly recommend that. One of my favorite techniques, though, is, you ever notice that when you get in bed and you turn off the lights, it's literally the only time of day that nobody's talking to you?
Yeah.
Right?
Yeah, everything is silent.
Right, and so all of a sudden, all of those thoughts come flooding in from anything that you were thinking about during the day, whatever that happens to be. They all come in, and it's like this, like a paintball, like you're just getting bing, 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 with all these crazy thoughts and things that are going on. So, and it's very hard to fall asleep during that period of time because it elevates what's called autonomic arousal. Mm-hmm. So you have these two different systems in your body, nervous systems. There's something called the parasympathetic and something called the sympathetic. Parasympathetic is the one that helps you digest and rest, okay? But the sympathetic is kind of the alert, fight, or flight. When you're thinking, you're in alert mode, and you can't be in alert mode and fall asleep at the same time. It's literally physically impossible to do. So we have to get you out of alert mode and into relax mode. How the heck do you do that when you've got all these crazy thoughts coming through the door, right? So one of my favorite techniques is something called a worry journal. Mm-hmm. So what I do is I ask my patients, not right before bed, what I do is about 3 or 4 hours before bed, so maybe just after their evening meal, sit down with a journal and, very simple, draw a line down the middle of the page. Write down everything that you're thinking about on one side and then one solution or thought about it on the other side. You don't have to solve the problem, but you can start to create steps to solve the problem.
Yes.
Right? And having those concrete steps written down means you don't have to think about them. You know they're on paper.
Yes.
You know you can come back to them the next day, and you can allow your brain to say, okay, I had all of these thoughts. Now I have all these plans. I can start to see, and the plan might be, I'm going to call the social worker to get an appointment, right? The plan might be, I'm going to commit to drinking, I feel dehydrated, I'm going to commit to drinking 2 more glasses of water tomorrow. It doesn't have to be some grand, unbelievably detailed, every single thing figured out plan. This just has to be one simple solution to the one thing that you're worried about. Then when you close it, in your head, okay, my stress level can come down a bit because I don't have to worry of what to do next. I don't have to worry about how am I going to deal with these things. And that really has a great tendency to lower that level of anxiety and be quite helpful. Now, that's the thing that you do at 5:30, 6 o'clock, 7 o'clock, something like that.
Yeah.
Michael, what do I do? And it's 11 o'clock and I'm lying in bed and I'm staring at the ceiling. What the heck do I do there? So there's a couple of things that I recommend during this situation. So the first one is called progressive muscle relaxation. Mm-hmm. So progressive muscle relaxation is a tensing and relaxing of the muscles. You start at your toes and you go and you like crinkle your toes and you hold it for 5 seconds, then you relax, and then you tense your feet and then you lift your legs and you do all these different maneuvers. Now, to be fair, you can go onto like your phone or the app store. There's a million of these progressive muscle relaxation audios out there. I think they're awesome. I created one. As a matter of fact, I'm going to give it to you as my gift for you for watching the video. So we'll have it available for download that you can listen to it. But this is something that you can literally listen to in bed, in the dark, as a technique to help lower your heart rate and begin to relax you. Yes. That's really what the goal here is to lower your heart rate. Most people don't know this, but in order to enter into a state of unconsciousness, you need a heart rate of about 60 or below, right? And so for folks out there, when you're thinking about stuff, guess what? Your heart rate's going cuckoo, right? It's going all over the place. So that's why when you focus on your body and tensing and relaxing, it forces you to not think of anything else. So number one, it's a distraction, which is great. Number two, it's actually a physical relaxation at the same time. So this is a technique that's been around since, I think, like the 60s. So this is nothing new, but it is very effective. Another one that I like people to do in the middle of the night or as they're falling asleep is called the 4-7-8 breathing methodology. Yes. This is a great one. So many people may not know this, but this was actually developed by the military. In very particular situations in the military, they need people's heart rates to go down very, very quickly.
Yes.
And so what they discovered is if you breathe in deeply for a count of 4, you hold it for a count of 7, and then you breathe out for a count of 8, right? That process, you do it 5 to 7 times, it almost immediately begins to lower that heart rate. And that's, again, the goal, right? Yeah. Then as your heart rate starts to come down, after you've done that breathing cycle, let's say 4 or 5 times, if you kick in your progressive muscle relaxation, here's what will happen. You will be distracted enough that the natural fatigue and the natural sleep deprivation and the natural sleep process will come right in, right? Help you fall asleep, okay? Because one of the big issues that we have in the grief situation is difficulty falling asleep. The second is difficulty staying asleep.
Yes.
Right? And so what happens is some people are like, falling asleep isn't a problem, Dr. Breus. I'm exhausted. I get in bed, whatever my process is, and I'm out. But then 3.5 hours later, I wake up to pee, and my mind will not turn off. I am off and running once again, right? Yep. Here's the good news. Both of the techniques, the breathing and the muscle relaxation, perfect for the middle of the night. Perfect, okay? Second is, depending upon what time you wake up, it might be okay to get up for the day, right? Yeah. If you wake up at 4:30, and you're normally going to be getting up at 6, lying in bed for another 90 minutes is simply going to be frustrating for you. So go ahead and use that time maybe for prayer, for personal reflection, for exercise, for something for you, okay? Because remember, you've got to take care of yourself during this period of time, because you're never going to be able to take care of everybody else, which is probably what you want to do. You're never going to be able to do that unless you're doing self-care as well as allowing the grieving process to occur.
Absolutely. Such good input. You know what I find is a lot of people don't realize that the brain cannot think, the mind cannot think in 2 directions at one time. So if we're forcing that to that muscle tension and relaxation, or even the breathing, we're absolutely pulling ourselves off that other alert mode.
There's no question about it. No question about it. Now, I don't know. I'm sure there'll be people who are going to be watching this from all over the world. But one area that is important, a little controversial, but something that we should mention is, depending upon what state you live in, there are different states that have cannabis as a legal recreational drug to use, right? And so I want to make sure that people know and understand that while cannabis can definitely be helpful for sleep, you really need to know and understand the pros and the cons of using something like cannabis. A grief situation is not the time to start, okay? Like, just to be very clear, because I had one patient who actually did this. They were here in California, which is where I'm based, and they had a situation, and they immediately went to a dispensary, and the situation became much worse, not much better. So while I don't know how cannabis affects grief as a total, what I would tell you is it's not the time to start during a grieving situation. Whereas if a doctor prescribes you a sleeping pill, you may never have had a sleeping pill before. That's a lot different situation, easier to control, to understand, and to understand the known side effects and things like that. Please, please, please be careful about using cannabis during a grief situation. I have read one paper that showed that using cannabis during that time actually made people feel worse, not better. Yeah. So I think you just need to be very, very careful. Good
advice. Really good advice. Well, I just want to thank you so much for taking time with us and for encouraging people in some very practical tips to help them get back on track. I think everything is upside down when you're grieving.
Yes.
And so this will bring about some more structure, routine, and kind of that predictability, which we're longing for anyway.
Yeah, I love the way you summarized it. It really is about structure, and there are some physical things that you can do to help lower your stress and to help you get some sleep. I'm excited to be a part of this and everybody's journey. I think people will find it fascinating. Please do download the MP3 that we'll make available for you to teach you how to do progressive muscle relaxation. It's super cool. I think you'll really dig it. I wish you well on your path.
Thank you so much. And we wish you well too, Dr. Breus. To be continued, hopefully.
Absolutely.
Take good care.
Mm-hmm.